Welcome to the On the Pen, the Weekly Dose podcast, your one-stop shop for obesity medicine news with your host, man on the pen, Dave Knapp. Welcome to this Tuesday, June 10th already? Can't believe it. June 10th edition of On the Pen, the Weekly Dose podcast. I am your host, Dave Knapp. Man on the Manjaro, that's why I'm here. You are on the pen. Wegovy, Saxenda, Victoza, Trulicity, Manjaro, Zepbound, Compound. That pen is what we talk about each and every week, and we're back after a couple-week hiatus. We did do an audio version of the podcast last week. An audio-only version as I was kind of recovering from the health scare. Thank you again for the support that you all gave me over the last couple weeks and the grace that you gave me as the news slowed down a bit. But I assure you that everything has continued to move in a positive direction from a health standpoint. I actually have an appointment here with a cardiologist just in a few minutes right after we record this podcast. So thanks again for bearing with me over the last couple of weeks. There's a ton to get into in the world of GLP-1 obesity medicine news from this past week. But before we do, whatever platform you're watching on, would you hit the thumbs up button, share this podcast with somebody who might find it beneficial as we continue to build out the one and only platform exclusively for bringing obesity medicine and type 2 diabetes medicine news to patients. We have our own thing now. And if you've been following along, we've not really slowed down at all in terms of the amount of content that we put out on Substack. So as I was kind of laid up the last couple of weeks, it was a little bit more challenging to do videos, but it was easy enough to write. And so we did a lot of writing. So if you're not following along on Substack, you can find that at onthepen.substack.com. To think of it this way, a lot of people get really freaked out by a new social media platform. It's not that. It's just a newsletter that comes directly to your inbox. Of course, there's a social media element to it, and you can dive in and learn as much as you want about it or not. Or just sign up for the newsletter. That's how we're getting our newsletter out these days. So just go to onthepen.substack.com or to our link tree, which is in the show notes. You'll find it there, and subscribe and get our emails. That has been hugely beneficial, I know, to those who have been following along. I got a lot of really positive feedback this past week. But jumping into a piece of news that I think was maybe one of the low-key biggest things that happened, and it was not covered widely. I don't think I saw it at all in the mainstream news, but a bill that we've been covering now for over 2 years on the pen. It's called the Treat and Reduce Obesity Act. It's been in committee. It's been sliced and diced through the committees over the last couple of years, and we've followed it along. But just a few weeks ago, I was in Washington, D.C. with a dear friend of On the Pen. His name's Mike Donnelly Boylan. You may know him as Mike on a Mission. And we were advocating for improved access to obesity treatments. We had meetings on Capitol Hill with several offices we stopped in. Some of them were less formal than others, but the most formal meeting we had was with a senator's office, the Senator Bill Cassidy. If you're not familiar, Senator Cassidy is one of the most influential lawmakers on Capitol Hill when it comes to health policy, he himself being a doctor. And we spent a good chunk of that meeting talking about accessibility issues. And of course, at the top of that list is insurance coverage and the urgent need for Medicare to finally start covering real obesity treatments. And so this is where the awesome news comes in, that bill, a refined version of that bill, the Treat and Reduce Obesity Act of 2025, has officially been introduced into the Senate. Now, again, we've been following this for a couple of years, and it's been in committee, but we have yet to see it actually put on the floor of the Senate for discussion and hopefully ultimately a vote. And I want to go over what the Treat and Reduce Obesity Act of 2025 would do, because this could be huge when it comes to insurance accessibility to the branded versions of these medications. So right now, Medicare beneficiaries who live with obesity face enormous barriers to getting any evidence-based treatments. So Medicare limits coverage of behavioral therapy to only a certain few primary care providers, and even worse, it flat out bans the coverage of anti-obesity medicine. Let me say that again. Even with a drug like Zepbound, which has shown an average of 20% weight reduction over 72 weeks, Medicare won't touch it. Patients either have to pay out of pocket or they have to go without. And that stems back to the fact that some of the early treatments for obesity were stimulants, right? And so I think the calculation there was that the government didn't want to go handing out a bunch of stimulants to elderly people who could potentially be more vulnerable to the cardiac risk associated with those. But this piece of legislation is definitely outdated when you have science and evidence-based treatments like semaglutide and tirzepatide, which have actually been shown in studies to be cardiac protective, that it's time for this to change. So the Treat and Reduce Obesity Act of 2025 would actually begin to change that. It would open up the list of providers who can deliver those behavioral therapies so that patients can work with dietitians and psychologists and community-based programs. But more importantly, it would allow Medicare Part D to start covering FDA-approved medications for obesity. And this is the type of breakthrough that we need. So I'm excited to let you know that some of our efforts, and again, I don't mean to take a on the pen victory lap about this. This has been the hard work and dedication of the Treat and Reduce Obesity Act has been, the lion's share of that work has been done by the Obesity Action Coalition. And so kudos to them for doing this, but it's also exciting to know that we were just there, just in the office of this senator, educating and highlighting the need for this type of legislation to be passed and for action to be taken, and to know that something happened. And so one of the things that we told you when we came back from that trip in Washington, D.C. was we were very excited about the prospect of the future of coverage for anti-obesity medications. And this is definitely the first big piece of evidence that has indeed been happening. And so that was a very exciting thing to cover this past week. If you want more information, it's all available in an article over on my Substack. I want to take a moment to thank our sponsors, Ro. Visit ro.co/OTP if you are interested in potentially receiving some care for obesity-related issues. So if you check out ro.co/OTP, you'll learn that with the Ro Body program, patients lose 15 to 20% of their body weight in a year when combining therapies where appropriately prescribed and lifestyle modifications. So ro.co/OTP is where you can learn more about that Ro Body program. They are, of course, the sponsor of On the Pen. We love them. We trust them. And listen, if you are looking at coverage for branded medications, again, with the scarcity of the compounded versions, the more affordable versions, it's never been a better time to take a look at that coverage. They have a checker tool that's available at ro.co/OTP where you can just pump your insurance information and they'll tell you what you're covered for, so you don't have to do the legwork there. But more importantly, when it comes time to get those medications covered, they will fight that coverage battle with your insurance. They know all the things that need to be said, all the information that needs to be documented and submitted, so that you have the best fighting chance at getting that prior authorization approved by your insurance company. Again, ro.co/OTP. There's safety information there too. If you do end up starting one of these medications, it's very important that you be familiarized with the potential side effects that come along with them. And that's, again, all available over there at ro.co/OTP. Ro, we thank you for sponsoring the work that we do here at On the Pen. Now, this past week, some more interesting information dropped on a rare eye condition, right? It stands for non-arteritic anterior ischemic optic neuropathy, or that's a mouthful, NAION for the rest of us. Here's what matters. NAION can cause sudden and sometimes permanent vision loss. This is a really rare eye condition. It's often associated with diabetics. It's associated with a host of medications that actually tinker with your blood pressure, something that I'm keenly aware of right now, given all my health issues over the last couple of weeks. But this was actually the European Medicine Association, their Pharmacovigilance Risk Assessment Committee, spent months digging through studies and post-marketing surveillance. Post-marketing surveillance is a fancy term for like a phase 4 study, right? Where people are out in the real world on the medication, and they're able to take patient records from electronic medical records, and they're able to aggregate data and find anomalies with people who are on certain medications compared to people who are not. And their conclusion was that 1 in about 10,000 people on semaglutide may experience NAION, which is a slightly higher risk for those with type 2 diabetes alone. So the warning label for semaglutide in the EU is now going to reflect this risk, and patients are being told to stop taking the drug and contact their doctor immediately if they experience sudden vision loss or a rapid decline in eyesight. We'll be watching to see if the FDA follows suit. I know that they've been looking at this. Again, this is very rare. It's still 1 in about 10,000 people. And people with diabetes are predisposed for this condition anyway, but sounds like what they found was the risk was slightly higher. This is something we've talked about and covered before, so this is not new news, but what is new here and what is worth highlighting is that the European Medication Association's Pharmacovigilance Risk Assessment Committee actually is adding this warning label to semaglutide after doing their surveillance on this. So worth noting, is it a reason for most people to stop taking their obesity medications? We know that there are a lot of risks associated with living with untreated obesity and untreated type 2 diabetes for that matter. But this is just something you want to be aware of, that exists and it's out there, and we're not going to hide from the fact that there are always things that are coming up that are teaching us what we need to be aware of, and we need to be putting that information out there. So interesting news out of Europe this past week. So moving along, this is really interesting news that came out this past week from a company called Metsera. So one of the things that is often talked about in the future of obesity medicine is the current medications that are out there have sort of progressed. The early GLP-1 medications like Byetta and liraglutide, Saxenda, and Victoza were daily shots. And with Trulicity, which was the first GLP-1 offered from Eli Lilly, it was also the first GLP-1 that was able to be taken once weekly. And then, of course, you had semaglutide come along, Ozempic and Wegovy from Novo Nordisk, and ultimately Mounjaro and Zepbound from Eli Lilly, all once weekly. So the move in the future is to look at less frequent dosing, or the potential for less frequent dosing. And along those lines, a company called Metsera, which is a New York-based startup, which is backed by a bunch of VC money, announced some top-line data from its phase 1 trial of what they're calling, and again, we got to find better names for this, but MET233I, which is an ultra long-acting amylin agonist, which is being designed to pair with a ultra long-acting GLP-1 agonist called MET097I, which we got some data on earlier this year. We'll fly back over that data here in a second. But 233I, which is their amylin agonist once monthly, delivered up to 8.4% placebo-subtracted weight loss by day 36, with some individuals in that phase 1 trial actually seeing an over 10% reduction in their body weight in 36 days. So we're talking just over a month plus a week, 8.4% placebo subtracted, which means basically they took the amount of weight that people on placebo lost at that time and subtracted it from how much weight people lost on the medication itself, and 8.4%, which is a huge number after 36 days. And again, this was a once monthly shot, which was shown to be very well tolerated. So this potentially has best in class among amylin agonists. We know that there aren't any amylin agonists for obesity on the market yet. The first one that will arrive on the market will be coupled with semaglutide next year. That's CagriSema, and that'll be coming from Novo Nordisk early on in 2026. But again, Metsera's long-acting once monthly shows to be better than data we've seen from CagriSema. And if you've been following On the Pen's articles that we've been doing, going back to the long-acting GLP-1, early data showed after 36 days, people on the GLP-1 alone, the long-acting GLP-1, lost 5% of their body weight in 36 days, which was later updated to 11% after 12 weeks. So 12 weeks, 3 months on the long-acting GLP-1, that's essentially 3 shots, I believe. 11% body weight reduction. And the idea is to combine these two together to get even better results and better outcome. So again, these are phase 1 assets, meaning they still have to advance to phase 2. But what gets me particularly excited about this is not the once monthly dosing, which people often say, well, I don't see the benefit. Why does anybody care about once monthly dosing? I think for adherence, when you look at the data, I think a lot of the data, surprisingly, for those of us who have benefited from these medications, show that a lot of people do stop taking the medicine. So to improve those numbers, perhaps long-term therapy adherence may be better. I think the main thing, though, is when you think about and I'm showing for those of you watching the video of the podcast on YouTube, when you think about these once a week shots, especially with Mounjaro and Zepbound, you have 1 pen for 1 week. That means for each month, you need 4 pens. So you basically reduce by 75% the amount of pens you need to administer the medication. And so when you talk about scaling and scalability and manufacturing and all the logistical reasons that these medications have been hard to come by in their early stages with these the early advent of powerful GLP-1s for obesity management, looking towards the future, being able to treat more and more people with fewer pens is not only just a sustainability issue, but from a manufacturing issue, it's logistics and just makes it easier to bring it to market for these companies. So the safety of these medications also remains a bright spot. According to this release, there weren't any severe or serious adverse events with these medications, with this long-acting amylin agonist. Of course, we have seen some data with CagriSema that would lead one to believe that it may be hard for some people to tolerate, even though it will be superior to semaglutide alone. So Metsera is a really, really intriguing contender to look at for the future. This is years away from hitting the market, but we can't help but be excited about any new medications that are in the pipeline that are not coming from a company called Lilly or Novo. Now, on the heels of this information, or actually this information was on the heels of some other really interesting information on a move that Eli Lilly announced, which was a deal that was announced at the beginning of June with a Swedish biotech company called Camarus. And this deal was to develop some ultra long-acting versions of its injectable diabetes and obesity drugs. More than likely, their future amylin candidate, eloralintide, as well as potentially retatrutide, which will hit the market in late 2026 or early 2027, depending on when it gets submitted and how long it takes the FDA. But this is basically a move where you see Lilly sort of making a counter move against some of these future long-acting drugs like the Metsera products that we talked about. So the technology at the heart of this deal with Camarus and Eli Lilly is a proprietary offering called Fluid Crystal, which is basically designed to deliver a steady therapeutic level of medication over an extended period, which would allow for essentially a longer half-life of the medications that Eli Lilly has made currently, which could mean that the therapeutic effects of the drug could last, instead of for days, it could last for weeks or even months from a single injection. So think of it like the difference between a daily pill that has kind of a slow release versus the ones that have an instant release. And it's technology that is being added to these medications potentially to increase the half-life. Now, this brings up all sorts of questions. I know that the number one thing that people have said to the article that we put out on Substack was, I can't imagine living with the side effects for that long. I think this is likely going to be for people who the toleration level has been positive. They've tolerated the titration process well, and more than likely for things like maintenance, or when a person is seeing, obviously the plan with the doctor would be to keep the patient on that specific dose for a certain amount of time. It'll be interesting to see how the titration all works out like that. Of course, it'll all have to bear out in clinical trials. But this is a huge deal between Lilly and Camurus. Camurus will receive nearly $300 million up front for this partnership, and then they'll receive milestone payments worth up to another $580 million based upon sales. So it'll be interesting to see. I mean, your once weekly injectable versions will still be available. This will be likely something that will be added to the arsenal of the doctors who may elect to prescribe it differently, and also hopefully be a pressure release valve again for Eli Lilly on the manufacturing of the pens, something to add to their vial offering to hopefully reduce the amount of pens that are required to service people living with the disease of obesity and type 2 diabetes. So this will be one to watch as well over the next couple of years as this develops, because I think this has the potential to be really exciting for the future of the space. With that said, appreciate you joining us in the office. I don't know if you caught on, but we're in the new office today. We've got a lot of work to do here on soundproofing. We've got a lot of work to do on decorating, so it's a little sterile, but you are getting the first podcast from the office. Now, if you want to support the work that we're doing here at On the Pen, as we continue to grow and develop the only patient-centric news platform for people living with type 2 diabetes and obesity, you can do so by joining the paid version of the Substack. It's $12.99 a month. And that helps us to grow. We'll be bringing on our first employee here this month. We've got the office set up, and Lord willing, we'll continue to build this thing out into something really special. So thank you for those who have been along on the journey. Thank you for those who have supported the work that we're doing. We couldn't, wouldn't, and shouldn't do it without you. We just absolutely couldn't. I got to get off to this appointment, but thank you for being here, and thank you for being the best part of what we do. We'll catch you next week.